Chloramphenicols, Chapter 13. Chloramphenicols. Chloramphenicols is broad-spectrum antibiotic first obtained from Streptomyces venezuelae in 1947. Ehrlich, Burkholder and co-worker in 1947 reported the isolation. It was later chemically synthesized, and the commercial products now available are only synthetic products. First antibiotic to be chemically synthesized for clinical usage. Chemistry. Derivative of chloroacetic acid and contain a nitrobenzene moiety which is responsible for its antimicrobial activity. Natural white or gray or yellow crystalline powder with a bitter taste. More stable in solution but need protection from light. Slightly soluble in water, soluble in most organic solvent. Mechanism of action: bacteriostatic drug. Interfere with protein synthesis, irreversible inhibit of 50S ribosome, inhibit the peptidal transferase enzyme, thereby preventing the amino acid transfer to growing polypeptide chain. Subsequent protein formations responsible for forming peptide bond between the amino acid of elongating peptide chain are also prevented. It also inhibits mitochondrial protein synthesis in mammalian bone marrow cell in a dose-dependent manner. Antimicrobial spectrum. Broad spectrum drug inhibit gram-positive, gram-negative aerobes, rickettsia and chlamydia mycoplasma activity not much in vivo. It has especially efficacy against Salmonella, including Salmonella typhi, but less action against gram-positive cocci. Like tetracycline, it is inactive against Mycobacteria, Pseudomonas proteus species, virus and fungi. Resistance. Mycoplasma and nocardia develop resistance quickly. Resistance may develop by inactivating enzyme chloramphenicol acetyl transferase that inactivate chloramphenicol, reduce permeability of the microorganism to the antibiotic, ribosomal insensitivity. Chance of multi-drug resistance is more because the plasmid may carry resistance gene for other antibiotic. Cross resistance with macrolides, lincosamides and tetracycline is possible. Pharmacokinetics available as base and ester, palmitate, sodium succinate. Absorption. Chloramphenicol palmitate given orally is rapidly and completely absorbed in monogastric animal and reaches peak plasma concentration within 2 hours. Chlorophenicol is also rapidly absorbed orally, although milk interfere with its absorption. In ruminant, chloramphenicol is orally ineffective as it is readily inactivated, reduced to inactive aminochloromphenicol by ruminal microflora and therefore given parenterally. Chloramphenicol sodium succinate administered by IV or IM route hydrolyzed into active free chloramphenicol. Ester are hydrolyzed into the base before absorption, well absorbed from GI tract of monogastric animal and pre-ruminant calves. In ruminant, drug inactivate in the rumen, well absorbed per rectum. Distribution. It is 45 in irreversibly bound to plasma protein and free fraction is widely distributed through tissue and body fluid. Cross all the cellular barrier and high concentration in all tissue, CSF, CNS, aqueous humor and placenta. The fetal liver does not metabolize it. Lipophilic and volume of distribution is large. Metabolism. Metabolized in the liver and conjugated with glucocoronic acid inactive metabolite. Excretion through urine and bile enter hepatic circulation. T half shorter in horse 1 hour, longer in cat 5 to 6 hours, longer in calf because of poor metabolism compared to adult cattle. The enzyme glucocoronyl transferase is formed early in fall, after 1 week, and hence shorter half-life. Drug interaction. Drug interaction. It should not be combined with drug, especially in immunocompromised patients. Example with penicillin is antagonistic in the treatment of meningitis and endocarditis. Mechanism not known. With lincosamide and macrolides antagonistic because of complete competition for the binding site 50s. Inophores severe muscle degeneration in broiler. Enzyme inhibition. Chloramphenicol is a cytochrome oxidase enzyme inhibitor. Toxicity and adverse effect. Dose dependent reversible suppression of bone marrow activity. More common in cat and in dog, it can be reversed on withdrawal of the drug. Thiamphenicol and Thiamphenicol and fluorophenical without the nitro group do not produce aplastic anemia. Dose independent irreversible bone marrow depression. Aplastic and fetal anemia. This is rare and is due to idiosyncratic reaction. Reports of aplastic anemia after exposure to chloramphenicol in the form of ophthalmic ointment restricted its use in food producing animal. Human being exposed to small doses through residue in food animal develop aplastic anemia banned by FDA. Occasional hypersensitivity, anaphylaxis, vomition, and diarrhea in cat and dog. Rapid IV administration result in hypotension. Gray baby syndrome. High dose in infant unable to undergo metabolism. Accumulate, stop feeding, vomiting, respiration is depressed, cause hypotension, turn gray color, coma and death. Clinical application. Its use should be reversed for serious infection in which the benefit of drug is greater than the risk of toxicity. Used for both local and systemic infection in animal. Choice of drug for salmonella and bacteroid septicemia. Also used in bacterial meningoencephalitis, brain abscesses, ophthalmitis, mastitis, intramammillary, parenterally, intraocular infection, equine dermatophilus infection, UTI, superficial skin and eye infections, and in otitis externa as 1% topical preparation. Systemic salmonellosis infection of deep structure of eye and meningitis next to penicillin. It is used to treat prostatitis in dog. Chloramphenicol dose. Species primary dose maintenance dog half-life. Dominant horse and foal, dog, cat, parenteral. Thiamphenicol and fluorophenical. Thiamphenicol, derivative of chloramphenicol, where NO2 group is replaced by sulfomethyl group CH3H2. Hence, does not cause non-dose related aplastic anemia. However, reversible bone marrow depression is possible. Spectrum of activity is similar to chloramphenicol, excreted unchanged in urine, and cross resistance with chloramphenicol is completely. Fluorophenical, analog of thiamphenicol with increased spectrum of activity than chloramphenicol. Difference between chloramphenicol and thiamphenicol. Chloramphenicol is highly active against salmonella, now resistant strain, more active against Haemophilus and influenza, inactive on entamoeba and plasmodium. Thank you so much.